the mandibular nerve has a sensory root and a motor root. Okay, sensory and motor root, and it comes out of the foramen ovale. Now, through the foramen ovale, there are four things that come out. M-A-L-E, male. M-A-L-E. So, we have the mandibular nerve. M, A is the accessory meningeal artery. L is the lesser petrosal nerve. And E is the emissary vein. Okay, so M-A-L-E, mandibular nerve, accessory meningeal artery, lesser petrosal nerve, and emissary vein. Okay, so all these come out of this foramen ovale. Now, from this foramen ovale, this mandibular nerve comes out, and it first gives off a branch which is known as the recurrent meningeal branch. Okay, which enters the cranial cavity via the foramen spinosum, and because it enters via the foramen spinosum, it is also known as nervus spinosus. Okay, then this mandibular nerve is associated with otic ganglion. Okay, otic ganglion that lies medial to the trunk of the mandibular nerve. It is medial to the trunk of the mandibular nerve. And then it divides into an anterior and a posterior branch. But before dividing into anterior and a posterior branch, okay, it is associated, there's a nerve that goes through the otic ganglion, but it does not synapse in the otic ganglion. Okay, that's known as the nerve to the medial pterygoid, which is a branch of the mandibular nerve which passes through the otic ganglion but does not synapse in it. And this nerve to the medial pterygoid supplies the medial pterygoid muscle, the tensor tympani, and the tensor villi palatini muscle. Okay, so if you see this here, okay, so this is your mandibular nerve. That is coming out through this foramen, and that foramen is known as the foramen ovale. Okay, this is that foramen ovale. But now the otic ganglion that we're talking about is associated behind this, medial to it. We saw that otic ganglion is associated medial to the trunk of the mandibular nerve. So this is the lateral side you're seeing from outside, right? So towards the medial side, what is this? So towards the medial side, yeah, this is your medial view. Okay, so medially we have this otic ganglion. Now, so this is the motor root, this is the sensory root. From the sensory root, here this comes, this motor root joins it, and here we have this otic ganglion. Now, we saw through the otic ganglion, we saw there is a nerve that passes through this, that is the nerve to the mylohyoid. The nerve to the medial pterygoid. Okay, nerve to the medial pterygoid. So, nerve to the medial pterygoid. And that not only supplies the medial pterygoid, so the medial pterygoid muscle is this. So this is the nerve to the medial pterygoid. It also supplies the tensor palatini, tensor villi palatini, and the tensor tympani. Right. So this will be the this is the tensor tympani muscle here. This is the tensor tympani muscle. So this is your nerve to the tensor tympani. So through this otic ganglion, we have nerve to the medial pterygoid, nerve to the tensor villi palatini, and nerve to the tensor tympani. These three nerves that come through the otic canal but do not synapse in it. Okay, and they are all associated in the medial side of the mandibular nerve. Alright. So the motor root, sensory root coming out through the foramen ovale, giving off a recurrent meningeal branch of the nervus spinosus, which enters into the cranial cavity via the foramen spinosum. Then comes out, there's a otic ganglion associated on the medial side, and it gives off a nerve to the medial pterygoid that basically supplies three muscles. That is the medial pterygoid muscle, the tensor tympani, and the tensor villi palatini. But they do not synapse in the otic ganglion, they just pass through the otic ganglion.